Well, good afternoon, everybody. Thank you for joining us today for our session on kinship mobilization, kin finding, family search and engagement, and kin mobilization. We are joining you today from the Grand Families and Kinship Support Network at Generations United. We're the first ever National Technical Assistance Center on kinship families and grand families. And for those of you who are not familiar with us yet, I know we have many repeat customers here, so to speak, but for those of you who are not familiar with us, I will put our website in the chat and please take a visit over there. We have over 100 resources that are newly created over the last couple years on engaging kinship families that are designed for professionals and variety of systems working with the families. So we have a ton of really practical resources. We also have a link to our technical assistance request form. We provide technical assistance to government agencies and nonprofits in states, tribes, and territories across the country, all free of charge. And whatever you need help with, reach out to us and we will do our best to help you. Also, if you need assistance with implementing some of the strategies that you are hearing about in these learning community sessions, we are happy to assist you with that as well. And we are hosting this in collaboration with Child Welfare Playbook and Marina Nitza, who is joining us here. She was the author of our Kin Finding Toolkit. I'll also put a link to that in the chat. And our learning community sessions are all highlighting all of the strategies in that resource. So if you're looking for many different ideas on how to engage, locate, engage, mobilize families, that is definitely a good place to go. So with that, I am going to turn it on over to Marina.
Thanks so much, Melissa. Hi, everybody. Welcome. We're going to have a guest speaker today from HHS ACL, Ryan Elza, who's going to share a funding opportunity with us. And then I will pass it to Emma and Linda. So Ryan, would you like to share?
Sure. Hi, everyone. Nice to meet everyone. My name is Ryan Elza, and I'm the Interagency Housing Innovation and Strategy Lead for the Administration of Community Living, which is an operating division of HHS. So back in 2021, HHS and HUD formed a partnership to form the Housing and Services Resource Center. So we have a technical assistance resource center that develops toolkits, guidance. We host national webinars. We provide direct technical assistance to states and communities to really help and advance community living. So we work across our federal partners to really identify opportunities to not only help individuals with disabilities and older adults find housing, but have the full wraparound supportive services that they need to live and thrive with full and independent lives in the community. So one of the initiatives of the Housing and Services Resource Center that I'm here today to talk about is our Housing and Services Partnership Accelerator, which is a 12-month learning collaborative that is open to states who have approved Medicaid authorities for housing-related supports and services under their 1115 demonstration waivers or their 1959 state plan amendments. So we launched the accelerator last year for our first cohort, and we're able to work with 8 states in the District of Columbia. And are excited to offer an opportunity for a new cohort of states where we'll be able to accept up to 5. So states are required to form cross-sector teams across aging, disability, housing, health, and homelessness to come together in order to kind of more rapidly and strategically implement their housing-related supports and services at the state and community level. And as part of that technical assistance collaborative, we have monthly peer learning sessions that will be open to participating states. We have an in-person convening that brings together all of the participating states, and then every state is assigned technical assistance coaches that work with them in order to help identify what their goals are and help them meet their goals. So really excited to help amplify the message and get the word out The deadline to apply is December 20th. I would encourage you all to take a look at the information. So I dropped the link to the Housing Services Resource Center, our website, to the Accelerators web page, and then also a program overview. The state team leads are encouraged to be the state Medicaid directors. So if you have any questions about whether your state is looking to apply, would encourage you to reach out to them and express any interest you have in collaborating with them on their application.
Awesome. Thank you so much, Ryan. Anybody have any questions for Ryan?
Thank you, Ryan.
Yeah, fabulous. We hope some of us will take advantage of this opportunity. This is exciting.
Thank you.
That I will pass it to Emma to lead our session today on maintaining a shared list of kin, which is one of those things that I actually hesitated when I put in the toolkit. I was like, this is obvious. And yet I think it's something where a lot of us can, there's some room for improvement. And also it's something you can do very tractably, right? It doesn't have to be a multi-year planning and legislation project. So with that, Emma, I will pass it to you. Thanks.
Thanks so much, Marina. And yes, I am so glad that you chose to include this one because this is something that we at the Government Performance Lab have seen folks introduce in their own jurisdiction and really make a difference in terms of moving the needle on being able to make more placements with kin and do so more quickly. Can you all see my screen? Sorry, I'm like having some.
It says Kin Mobilization Learning Collaborative.
Wonderful. Yes. Okay, now it's moving. Okay, great. Hi, everyone. I'm Emma Craig. I am with the Government Performance Lab. Really excited to be back with you all. Excited to see some familiar faces. I'm also joined by my colleague, Linda. Linda, do you want to come off mute and say hey real quick as well?
Yes. Hi, everyone. My name is Linda Blancato from the GPL. Excited to be here with you today. I'll be mostly in the chat, dropping questions and responding there.
Thanks, Linda. And we also have a couple folks from a few different jurisdictions across the country joining us to share their own stories and journeys and examples of how they're maintaining a shared list of kin. And we're going to do some Q&A. Really excited for that in a few minutes. Before we do, I wanted to very quickly, if we haven't gotten to meet you yet or join you on another call, I want to very quickly tell you a little bit about who we are at the GPL. Government Performance Lab, or GPL as we like to say, is a research organization out of Harvard Kennedy School of Government. And in our work, we work alongside jurisdictions, so both state and local governments, in developing and testing promising practices in a variety of different policy areas or focus areas, but all in ways are in the name of working towards building more just and effective service systems for the folks who are being served by these systems. So we do this across different areas, everywhere from child welfare, like a lot of folks on this call, Linda and I both work in the children and families policy space. There's also criminal justice reform efforts, things like transforming procurement processes within local governments. These are all different sorts of things where we're working shoulder to shoulder alongside folks in government to test and develop and see what sticks and what works. And once we do, find ways to share that in larger groups like this setting. We see building and supporting kin first management strategies within agencies and systems as being such important transformative work in a way to make it possible for more children to be able to stay close with loved ones in what is otherwise a really tough time of transition, and really believe in the efforts and power of building and maintaining a kin first culture. And as I already said, in supporting folks on the ground, thinking about building out kin first management strategies and implementing them within their own systems, the concept of maintaining a shared list of kin in order to, one, make sure or set folks up, folks being staff on the ground, to be able to make more placements with kin possible for the children and families they serve, and to do so sooner when possible as a result of sharing a list and working together collaboratively across what is often many handoffs, right, that we know happen within a single agency or within supporting a single case. And so, like I mentioned, we've supported folks on the ground testing this out and learning from this process. And some of the things that has really stood out to us is like, why does this matter? Why can and should this be making a difference? This is how I would sum things up, but I would also invite you, if you've done something similar and you have additional thoughts, please drop them in the chat or let us know. I think we've seen this concept of maintaining a shared list to really make a difference in preventing information getting lost among the many handoffs that often happen in a case. Right, having a centralized list can prevent those contacts from being lost. It also deduplicates staff or efforts, right? If we're in the case where, or in the situation where an investigator up front is asking about kin and finding some initial names, contacts, but that's not getting passed along, and someone is later on following up and doing it all over again. How can we streamline and simplify, save time for really, really busy staff? And also, how can we do this to be even more respectful of our family's time, to not be asking the same questions, and to be hearing and thinking about what's been being shared, and working together on building out that network for the entire family and for that child coming into care. We also see it being really instrumental in relation to the fact that we all know things take time, right? Their families experience change, new developments might happen over time. A caregiver might initially not be willing or able to accept a placement, but later on might have a change in situation or experience that as a result, if we have all this information documented and saved in one place, we can go back and follow up and keep tabs and continue to keep that person involved in the child's life in the interim. And that brings me to the third point here, which was really interrelated, is, when we say we're thinking about building a kin first system, we're not just thinking about in the name of being able to make a single placement with kin, we're thinking about in the name of being able to build that child's network from day one, from the moment that they come into contact with our system or agency, and think about how can we keep relatives and fictive kin plugged in and supporting both that child and family beyond the life of case and during. But within that, in maintaining all this in one place, that really reinforces that concept that we're not looking for that single placement option. We as an agency or system are committed to building out that wider network. And my next slide is just a little visual of how we view or think about that kin first culture in which we're prioritizing building out that larger support system, in addition to thinking about their use in relation to placement and permanency options. We also know that family and trusted loved ones can be so instrumental in things like offering additional emotional safety and belonging to that child, things like visitation and reunification, supporting those efforts, maybe respite, transportation, additional childcare for another caregiver that is supporting the child. Just thinking about all those additional network building efforts that are possible, maintaining and documenting a shared list really helps build this principle into, or bakes this principle right into the ethos, into the culture of an agency who is committed to doing this for children coming into their care. And then Linda also, let's see, I'm making sure I'm not looking like I'm missing anything in the chat. I know sometimes folks really resonate with this. Yes, Francisco, I see your comment on the many ways that, the supports can happen beyond placement. And yes, Heidi, I think the example of reunification and all the ways that they can be a supportive resource in the process is, again, I think just all baked into what we're talking about here, and why maintaining a list is not just for placement, but for building out that full network. Thank you all. All right, that was a whirlwind. Why we think this is so important, why we're excited to be here. And today we're going to hear from folks both in Florida and also from Rhode Island about how they are thinking about and have implemented a shared list. And I think one thing we're going to drive home is, like, when we say maintaining a shared list, that does not have to be some super fancy, technologically advanced platform. It can be. That can be an excellent technique and way within your system, but there are also lots of different ways to think about capturing and sharing that information. And perhaps the most important is that being clear and streamlined and shared in across your agency, so that folks are doing the same thing and sharing and passing along information in every step of the way. And so to talk about things and make this real, first we have Brianna joining us from Broward County, Florida. Brianna, I see you. Thank you for being with us today.
Thank you.
I was going to
pleasure.
just for a second share the log and then take this down so that we can just see each other face to face, if that's okay. But since we have a
Yes.
visual of your log, this is the
Yeah.
Family Finding Connections log from that Broward County has developed. And this is a visual representation of a PDF, a fillable PDF in which this shared list, or which we're calling a log in this context, is not only a singular central place to document, but it also very intentionally breaks down the different types of connections that we might be asking about and looking for, in the name of prompting staff early on to make sure they're asking about all these sorts of connections, right? We heard and saw that sometimes maybe victim kin weren't getting asked about as extensively, or maybe we gravitate more towards the maternal side than the paternal side of that child's family in our questions. And so this was a way to think about counteracting or prompting staff to be thorough, to capture that information and to keep building on it. And then in addition to this visual, Linda actually just dropped a link in the chat in which you can download a copy. There's both a blank copy, but there's also an annotated copy of this Family Finding Connections log to give an example of how it gets filled out. But enough for me. I'm going to stop sharing. And Brianna, could you talk a little bit more about how you as a team got this going in Broward County, and what the Family Finding Connections log is setting you up to do now?
Yes, absolutely. So it was definitely a team effort, a collaboration between us and the CPIs and Emma to get this started and really implement the process. And it started with the idea that oftentimes we were finding that the investigators were going out on an abuse call, and we're out in the field and in an emergency type situation and looking for placement, which is often, the most pressing thing. But they would often come across other relatives or meet or get other names of individuals that maybe couldn't provide placement, but would like to be involved. But that information, if they weren't able to provide placement, was sometimes discarded or left like on a sticky note in a car or something like that, and not being passed on to the case manager or the next person that was going to take over the case. And if it was documented, it may have been documented in a case or documented in a case note that was buried somewhere. And when the next person received the case, didn't go back and have the time to really dig through and find that phone number or that name. So it started with that, but we also found that sometimes there were people that were explored that maybe were not able to accept placement. They were denied maybe because of a criminal disqualifier or a housing situation, or maybe something that was even temporary, like being on vacation. So some of those things we were able to circle back to, but to also prevent like a duplication of work, having that shared list, initially I wanted, really advocated to have a note also added in. So you'll see that in the connections log, that there's a note as to any information that we found out about that relative that may prompt the next person that receives the case to follow up on it. And we have found that to just be so, so helpful. And cutting down the length of time that a child may be in licensed care, but also, helping us to circle back and collect additional information from relatives that maybe weren't able to provide placement, but have a bunch of information to provide us with and can help in other ways.
Yeah, and I think that was super sad. I don't know if this was you. This is probably you, Brianna, that like even the choice to call it a log, like the concept of like it's not just like a single list that's there and it's stagnant. This is a log that we're continuing to build on and update and refer back to and add additional notes to. I think it was like a really powerful testimony to like how you approached this and introducing it to your staff. I'm curious, could you share a little bit about how do you feel since you've been using this more? What has it changed or what has it shaped? Have you seen it make a difference in being able to make placements with kin or follow up?
Absolutely. We have had multiple placements take place much quicker, and some that maybe would not have taken place at all had we not had this log. I recently worked on a case where we had a grandfather that was on a state. And his information was provided to us at the time of removal by the CPI and documented on that log. And although we were told he couldn't provide placement, we knew that he was an important person to talk to. And by calling him on day one, we were able to get the name of another relative that was able to provide placement. And we were able to initiate that home study request within the first week of shelter to get that child moved. So it's definitely helping.
That's a great example. And I think kind of like speaks a little bit to both, like you ultimately made placement, but also it was about maintaining that connection. Are there other examples that come to mind of like, in addition to the placement making piece, how you've been able to use the log to preserve family connections for the child in care?
Yes, absolutely. And it is a lot about expanding that network, because I have another one that I'm working with right now that the relative works overnights, and so that's a barrier. But by documenting other relatives and expanding that network, we were able to talk to people that were able to maybe not provide placement, but could provide babysitting during that night shift. And so by engaging that whole family unit in the discussion and allowing them to be the experts on their family, we were able to come up with a really viable plan to provide care for this child and keep her with her family.
And how has it been, Brianna, in terms of, I mean, y'all are a big team. This was a big thing, right? Something new and different. I'm curious if you would share, we're also going to talk about just like kind of the nitty-gritty idea of implementing something new and, building that culture around why this is important and messaging to staff. Anything that you would share there in terms of like how it went introducing, how you got folks to get used to it, any tips or ideas for folks to hear?
Yes. So I think for us, it was really important to have a point person that was going to really own this and to follow up on it, and to continue to bring that to staff's attention to ensure that it was being used and that it was being referred back to. Anytime there's a new process in place, it does take some getting used to. And that was definitely the case with the connections log as well. But as we've rolled this out and we've continued to refer back to it and make sure that it is uploaded into larger system, our computer system at certain points during the case, we have noticed that we've had a lot more people following up with us and asking questions about the connections log and even referring back to the log at a later time during the case to reach out to relatives. And sometimes even back to parents if they've lost the current phone number. We sometimes have information that we were able to document early on from the time of investigation, such as an email address or something that may had not otherwise been passed on, and allowed that case manager to get back in contact with the parent or with a relative. So it's been very helpful.
Yes, and you might have already said this. I don't think, can you tell everyone how is this shared across your team, or how is it possible that multiple folks are accessing and adding to it?
So we have two different things that we're using. We have SharePoint that we upload. So that's a live document where anybody can go in within our agency and they can view it there and access it. But then we also have our statewide system, Florida Safe, FSFN, Florida Safe Network. And we uploaded there at the 90-day mark, 90 days post placement or post shelter, sorry. And it is frozen there. It's not a working document in that system, but it is visible to anybody that's assigned to that case.
Thanks, Brianna. I know that folks in this group appreciate those sort of details as they're thinking about being very tactical as well. And as I want to, before we transition and hear a little bit from Allie in Rhode Island as well, I want to make sure, does anyone have questions specifically about the Family Finding Connections log? Obviously, Brianna's here and can chat as well, in the chat, but let's see. I'm making sure I didn't miss anything for you.
I do see Antoinette asked how we are able to ensure the staff maintain this practice. So we do have a family finding unit here in Broward, which I oversee, and I do meet with my staff weekly, actually, on new cases and to get updates on cases that we've been working on. And so through that, I am ensuring at these individual supervision times that the connections log is being completed and updated and uploaded. So, and we use I use different tracking tools to ensure that it's uploaded at that 90-day mark and passed on through email also to the primary caseworker.
And then we also have a question, Brianna, about state level oversight, if you have any state level oversight in this process.
So as in the state of Florida, we also have family finders that are working directly with the Department of Children and Families. And so their unit is also tracking family finding efforts, as is our quality department, to ensure that, that we are also meeting that standard and making efforts to find kin.
Thank you so much, Brianna, for being here and for sharing. Thank you, Broward County folks. I see a couple others as well. And we love hearing more about the process that you all have been going through, and just like the norming of like, this has been a journey that you all have introduced and continue to build on and grow from. And so really appreciate your willingness to share. I'm going to pass the mic over to Allie from Rhode Island. And Allie, I'm wondering if, let me see if I see you. Hello.
Hi.
Yes. Hi. So glad you're here. Could you tell us a little bit more about, you all have a slightly different approach in how you think about maintaining a shared list. Could you give us a little bit of overview of what you do in Rhode Island and how it's helping your team?
Yeah, so for us, we do something called a TLO, which stands for the last one, which is a report that we use through, it's like an internet service that we pay for. And within this list, we get list of relatives, phone numbers for like whoever, like the parent or say relative we're looking for, addresses, email addresses, so all of that information. So upon a case opening to our family unit, a TLO is done for every parent. So we send that immediately over to the worker, that new social worker and that supervisor. And we actually put a note into our system. So for Rhode Island, it's our richest system. And that's where all like the case notes go, all of our information goes. But if at a later date, somebody wants to look in the case and to see when we've ever looked into family or what has been done with this family as far as family preservations, you can take that tab and look for that only. So we have a specific tab within our case notes that's called Preserving Connections. So at any time, if somebody is looking in our case, they can filter to our Preserving Connections tab and they can see what we've done as far as family work. And that's just for the Family Search and Engagement unit. If the worker does things on their own and continues conversations, those obviously goes in as case notes for them, but for us, it's family preservation. So we're able to use our system that we already use and everybody has access to be able to put those notes in. And right off the bat, when we're getting that case, these are completed initially. And then we ask them to look the caseworkers, like, please look this over when you meet with the parents for that initial visit. Maybe you can spend the time looking at this if the kid wasn't placed with kin off the bat, or maybe the kid, went to the hospital first and is in residential, maybe that they have more time allotted. But we're also really, like, that is a big thing for us in Rhode Island, is placing with kin. So if we're placing in a non-relative, when that transfers to the family service unit, they're automatically relooking into if there's any family. We're going to circle back and see if, within CPI, yeah, it was a fast transition. We needed to get the kids out. We had 48 hour, like, we had a 48-hour hold, but now we have more time to dig in and see if we can find either family, fictive kin, somebody in the school system, somebody that has a connection with this kiddo, and maybe we can use that. So the tool is TLO, but the way that we track it is our family connections tab.
And I think the fact when you described this to me, I was like, oh, wow, like a new future unlocked, just because in working with folks across the country, so often I think that challenge of like, it's not that folks aren't asking about kin, but when there are so many notes on a case,
Oh
things
my
just get
gosh, yeah.
buried and fall. And so the idea of having something where you can filter and pull up specifically those connections throughout,
Yeah.
imagine is really, really helpful.
And I think it's hard when you're in investigations because the parents sometimes they just freeze and they can't think. Their mind is so in so many different directions. They can't think of that one friend that could possibly be the person, or a distant relative that could be appropriate, So I think sometimes, yes, when it gets to our FSU, our Family Service Unit, they have the ability to go back and look.
And what I was going to ask you next is actually, I think,
Yeah.
very related to also what
question.
Heidi is chatting and asking about, what supporting staff and continuing to keep the tab updated. I'm curious, just you described you do this on the front end and you pass this along. How do you get things to work, in the sense that how are you collaborating well? How does everyone clear in their roles? How are you following
Yeah.
up to make sure this continues to happen?
So staff now, I was a social worker prior. This didn't happen when I started, but something that we've started probably within the last 2 years is that our family service, our family search and engagement unit, which is it's Rhode Island, so it's me and one other person. We actually meet every new employee that's coming through as a CPI or a social caseworker. So right as they're getting introduced, we're going and we're doing a whole training on what our job is, what our role is, how they can reach out to us, and kind of setting that up for them. So when, because we also work on removals for them and we'll work on placements, if down the line they need help, but it sets up that connection with them. They've seen our faces. They know who we are. We have 3 locations. We actually each go to each location once a week, and we walk around and we talk to all the social workers, and we have maintained really great relationships with the social workers. They're not afraid to reach out to us. They call us, they text us, they email us. So I think our relationships that we've formed are like pivotal to like how well this is working for the department. And it's just communication, and always making sure that we have them in the loop. It's their case, it's not my case. And your case better than anyone else. I think making sure that they know that they're the lead and we're there to help. It's just those roles and how we have shifted that it just works so well with each other. There's no stepping on toes when it
Right.
comes to
So I'm
someone's
hearing you
case.
like creating that collaborative culture, but within that having really clear roles, so
Yeah.
that like you're each doing your own respective work, but you're there to support each other. And what, in terms of, so you get things started, but in
Yep,
terms of follow up,
they
they're
do the follow-up. Yeah.
and they're actually, and so as additional contacts or new information comes through, you've gotten them started and they're coming back and adding.
Yep. Yeah. So they'll ask us to, reach out to somebody, if they're like, hey, we remember you did this TLO 2 years ago and grandma wasn't available then. Can you give her a call back? Like, we're swamped. Like, we have no problem helping them out and doing those kind of things for them. But it's just collaborating. And a lot of times they'll say like, oh, we read your note, or, hey, can we follow up on this note that you put in? We put a lot of notes into the system, why somebody said no, if they didn't answer, if they were red flagged, so those kind of things kind of weed them out for them to do their follow-up.
So also helping them kind of order their steps.
Yeah.
And streamline. Okay, I see. And then in this and working together,
Yeah.
do you have any stories or an example for us of how, as a result, you really think like this is a piece that's allowed you to either make a placement sooner or explore a new connection as a result?
Oh yeah, we found so we had these 2 teenage girls, and I don't know about other states, but we have a really hard time placing teenage girls. And we called everybody on. So there was a worker and she was like, I have exhausted all my avenues. Like, I don't know who else to call. So we called everybody on the TLO. And we actually were able to place, we found a grandparent through the like likely associates tabs on the TLO. And we were able to call that grandparent, and they were like, oh, it was a guy that answered, and he's like, oh, my wife is their grandmother. And we were able to link them up, and they took both of those teens in placements. And we have so many placements that we are able to use from like what we use, but also like follow up where like maybe something didn't work, but somebody reaches back out to them a few months later. Because we'll text the family members, like, say if we talk to them and they're like, hey, we're not available, we also text them the worker's information, and we'll say like, if things ever change, here's the worker's information, so please call them back. So they'll have people that come back a few months later that maybe their circumstances have changed, maybe they're not helping with an elderly parent anymore, or you know what I mean, something shifted, and they'll be able to reach out to that family member. But we have a lot of success with placement. I think we're like in the 70s or 80s with having 80% to having kids with kin or family in Rhode Island. So
Wow.
we're very heavy on the placements with family.
That's a great like aspirational goal, and good.
Yeah.
Thank you for sharing that with us. And also, I mean, yes, I think there's a lot, like you said, in terms of for all kids coming into care, but also thinking about
Yeah.
transition age youth or older youth, and how that can be particularly challenging.
It's
But
very
also
challenging with the older kids.
yeah. What a bridge can caregivers or even fictive kin, different sorts of relationships can play in a
Yeah.
teenager's life. Wow. Well, congrats to you. That's an
Yeah.
incredible number. Keep up the good work.
Yeah.
Thank you. Does anyone have, I think I'm keeping up with the
Someone
chat.
asked what our number is, and I don't
Mhm.
have that. I don't have that on me. My boss has that, but I don't know how many are currently in care now.
Let's see. And they have, okay, so we can follow up on that. There's also a question. Let's see.
If the first placement failed, we revisit the list. And not only do we revisit the list, like we'll talk to that provider and say, like, why did it fail for you? What wasn't working? Was it childcare? Was it behavioral? You know what I mean? Those kind of things. And then when we're looking at the list and we're calling family, being able to describe a little bit better to them what they would need to do in order to take this child. That maybe the needs are greater. Obviously, because of HIPAA, we can't give much information, but we can say, like, we can give certain information on, like, there was a hard time in the previous placement. You can give certain information without, violating HIPAA, but then also referring them to the social worker to talk more about what could we put in place to preserve this next this next placement.
Yeah. I see. Okay, that's like helpful too. And again, just comes back to the concept of like maintaining the shared ongoing list
Yeah.
and documentation, how it's so important to keep
And
referring.
we say to redo a TLO like every 6 months, because things can change on a TLO.
Okay.
And a lot of times, like, the likely associates could be somebody who's shared an address with the parent, shared a cell phone bill, have had some sort of connection to that parent. And it's super helpful. So maybe that's changed. Maybe within the last 6 months, somebody else has come into their lives that maybe mom wasn't thinking of, or dad wasn't thinking to talk about when we were meeting with them, or maybe the parents are closed off and they don't want to give information. So that is super helpful to just redo it every 6 months and see if we come up with any new information.
Yeah, that's super helpful to hear timeframes too, in terms of Brianna showed like the handoff at 90-day mark, how
Mhm.
the transition, you all are thinking about 6-month updates. Yes,
Yeah.
keep going. That's great. Thank
Yeah.
you. Thanks so much for this example. And folks, feel free to keep asking questions in the chat. For the sake of time, I see that Jason, you are also on here, and we have Jason joining us from Westmoreland County in Pennsylvania. And a little birdie told me that you also maintain a shared list of kin. I'd love to learn more about what you folks are doing in Westmoreland County.
You're on mute, Jason.
Yes.
Great, thank you. So yeah, our shared list that we have, our system we're using now is rather new. So if you don't mind, I'll kind of talk about how we got to the point where we needed to have this shared list. So Okay, so Westmore and Pennsylvania might be a little different from other states in that our children and youth services, while we're regulated by the state, we're county administered. So all 67 counties in Pennsylvania administer their own children and youth services. So essentially, all the counties we're told what to do, but we're not given all the tools by the state necessarily to do that. So we have to do family finding, we have to do family engagement. It's kind of up to the counties to determine how we do that. So the system we had in place since 2018 or 2008, sorry, wasn't developed with family finding in mind. So really the problem is I'm sure a lot of people on the call know, is that we enter it into the case file and things get lost, in hundreds of pages of case file. And while we did focus on family finding, certainly some of those cases, as Rhode Island said, we get lost, where people would say they might not be a placement now, but they could be in the future. 3 years later, you don't remember that. It got transferred to a different caseworker, it got transferred to a different supervisor. Nobody remembers those phone calls unless they're digging for it. So we kind of last year kind of said we need to have a more organized way to do this. We need to have something that's online that we can update live, that kind of has a list of all potential kin, for the families. It has to be user friendly, because if we want caseworkers to use it, it has to be something that caseworkers feel comfortable using, that is quick. So we kind of started looking into a couple different options. Similar to, I believe it was Rhode Island, we had something similar to the TLO called Accurant as well. And it would give information as far as who the family was, who possible family was, who possible associates and addresses. But we found that it wasn't super accurate. It was giving us names and addresses. We would send letters out and these people had no idea who we were talking about. So there were some concerns there regarding breaches of confidentiality when we're sending things out to people who actually shouldn't be getting information. So the new system we're using now is actually through a company called Binti. It is a completely online family finding application where we're able to kind of track who all the family members are, separate from our own case files, so things don't get lost in the case file. You're able to track what the relationships are, when the last time that they talked to them, and what the level of support that the family wants to offer. So whether it is just transportation, or whether it is visits, or just or they want to be a placement option but not right now, we're kind of able to track that for every single child, and also list their what that relationship is as well. So we started that. It went live actually last month, and we were able to upload 650 kids that we're currently active with into the system. And now the caseworkers are now in the process of transferring all of their currently pen and paper or family finding information almost into this new electronic system, which is just going to be incredibly helpful for the caseworkers to utilize, particularly for our on-call workers who might not have access to the caseworkers' work whenever a crisis happens. They'll be able to access this 24 hours a day, whether they're in the office or not, and be able to help with those emergency placement situations. The other really interesting piece, and something that's really user-friendly for the caseworkers, is, I mentioned the Accurant report. This new system has an integrated search function that is very similar to the Accurant, where it's, again, it does the same information, but it'll automatically pull that information into the electronic system. So all that demographic information, all that contact information is already in there. So it decreases the amount of work to kind of to track that and keep it, because we're really looking for, as far as the caseworkers' perspective, we want the caseworkers to use this. We have to make sure that it's as easy for them as possible. And the system so far that we have, we've gotten really good feedback from the caseworkers that they find that this is going to help eliminate cases that had previously fallen through the cracks because things get lost.
And I mean, I think the story that you set us up with, Jason, is a very relatable story, right? The idea of things getting lost through case notes and thinking about how do we consolidate, how does this make sense? But also what you just described, you summed that up very well, but I'm assuming that was a pretty big transition for you all as a team. I'm curious if you have any like
Yes.
stories or how you got folks on board. It's great to hear that they're using
Okay.
it. What was that like?
Well, so it kind of started last fall. Before we were even looking at this company, we were kind of having a discussion as far as we needed to revise our family finding and our kinship care policy. It hadn't been looked at for a while. What we had written in the previous policy in practice, it really wasn't working. So we're like, all right, what do we do? What can we do to revise this to make this better? And at the time, we were kind of creating some new forms, usually Excel forms and things like that, similar to, I think, Florida had shared, but they didn't mix well with the system, our case management system we currently had. We can upload them, but we couldn't edit them live, so we would have to, it was like trying to fit a square peg in a round hole. We would have had to re-download it, edit it, and then re-upload it, and it just wasn't user-friendly. So we were kind of kicking that around idea, and we're like, there has to be a better way. And then that's where we kind of started talking with this new company, Binti, about that and how they're doing. And exactly what we were talking about in our meeting as far as how to make this user friendly, they were already doing. So instead of reinventing the wheel, and trying to figure this out, we really at that point started getting talks with them about what their product looks like, what their demo looks like, and how it can meet our needs. So we kind of brought a group of caseworkers, a group of supervisors, some of our case aides, and our foster care staff together. And we kind of had a couple different demos to them to kind of get their feedback on it, because while I think it will meet the caseworkers' needs, I wanted to hear from them, because they're the ones that are going to be using it. So we presented to them, and they thought it was great. It really met what they wanted to do. So by that point, it was meeting with Binti, developing the system, and then kind of writing a workflow for the staff as far as how this is going to work. Because in order to have anything work well, everybody has to have the same expectations as far as what we're going to do. So we wrote workflows as far as for cases that are for kids that are already in custody. This is what we have to do. For our current kids we have in custody. For new cases from here forward, this is what we have to do. We are requesting that integrated search function be done immediately upon the kid coming into care, so that those results can be reviewed, with the parents at the shelter care hearing, which is 72 hours after taking custody. So that way we're starting to get that review of that information and getting in contact with those people, on the front end. From the time that even before the kids are in custody, any cases that we are accepting for services, and we're working with the families even long-term on in-home cases, we're including those cases in here as well for really preventative, so we're compiling that list of potential kin, if the child does come into care and needs a placement, we already have something ready to go, so that way we're not struggling to try to find those, during a very traumatic and chaotic time. We might already have those placements ready to go ahead of time.
Right. And like Marina just said in the chat, like the concept of being enabled to be more proactive, enabling
Right.
that those proactive kin efforts is great. And I think also hearing you say that, like specifically thinking about kids who would have or could have fallen through the cracks, and that number, like hearing that number and thinking about specifically how maintaining and updating and centralizing a shared list for like refreshing that list for everyone is helping you connect with those.
Because I think with in child welfare, there's such a turnover in staff in child welfare in general, that these families unfortunately go through several caseworkers often during one time that they're involved with us, and some of that information gets lost when people leave. So having it centralized and an electronic copy, allows for better organization service for the families.
Thank you, Jason, for sharing this with us. This is great. And you did not know this, but you teed me up quite nicely for our last couple of slides of discussion today. I just wanted to bring us back to being really implementation focused and thinking about not just why is this important, but how could we think about, if we're considering implementing this or one version of a shared kin list, what we've seen to be really impactful or helpful in driving that change at the agency level. And I think all three of you have spoken to these principles. So I'm going to walk us through these. But again, I think I'm only reinforcing what each of you have already shared. And thinking about what we've seen in supporting folks on the ground is when you're thinking about introducing something new or, to begin using a shared list, making sure that, obviously making sure you're soliciting feedback, but specifically where are the opportunities to enhance on existing kin search practices, right? Like Brianna named that PIs, we're asking, we're getting information, acknowledging that that was happening, and how do we build a system or process to further activate that good work that's happening on the ground. And I think that building on that and strengthening those efforts feels like a win-win to all involved. And it sounds like, Jason, you all were proactive or together building that out, which is great. I think that we've also seen that, I think basically, right, collaborate and then collaborate some more. In addition to just thinking about, okay, what's actually happening now? How do we feel about it? As we're thinking about establishing a new protocol and introducing something, the more straightforward of process, the more likely it is to stick. I mean, you essentially set the station, right? Like we want something that's straightforward, that folks can latch onto and be able to integrate into their work stream. And we know your folks are busy. So how do we build this in and make it clear, not just to save time, but also clear roles to better collaborate, like Ali was talking about earlier, right? Different folks owning different parts of the process, but everyone being clear on that so that we're deduplicating efforts and we're all clear on how we're working together to make it possible to make more placements with kin. And then the last tip or thing that we've seen to be really helpful is pairing the introduction of something new, like a shared list, with an applied training and time for discussion and prompt to where we're going through this together. And it's not just a, here is a list, please use this. It's a, here, this is where the list lives. Let's test filling it out together. Oh, is SharePoint giving you a glitch? Let's troubleshoot that. Let's talk about that live. Oh, what is Menti? How does this work? All right, let's sit down together and walk through, practice with staff, like, how to fill out live, also drawing attention to all the components, right? To make sure that folks are not just using it, but using it to its full capacity. So just really taking that time to build in and invest in that training upfront to set things up for success. That's the last. That's nothing crazy, but just good reminders and things that we've learned as we've been walking with folks through the process, but would also invite Jason, Brianna, or Ali, if you have anything you'd want to add as a tip, or if anyone else has something that they'd like to add, please feel free.
I just wanted to say, yeah, that or wanted to add that, having this list early on has been really important to us also in regards to building trust with families and relatives. By being able to reflect back or review that and those initial names and refer back to those very first conversations with families when maybe they had not been able to provide placement initially. But we're circling back, acknowledging that first conversation is helping that family to really know that we're doing our due diligence, that we are following up, and what they're saying also matters, and that we're listening. And through those follow-up conversations, we've had a lot of success with getting additional names of relatives that maybe weren't coming up on searches, but are playing a role in the family. So that is that tip to circle back, even if they can't provide placement, is really, really been beneficial for us and really helpful.
They just want to get out before to say.
Yeah, one of the pieces of advice I would probably have is, make sure you bring in your family courts in as well, so that they're aware of what's expected for staff as far as family finding. I know while we have those conversations with staff, also if they know that they're also going to be asked about it in court, sometimes that puts a little more urgency on it, even though I think, that the work alone will put the urgency. If they know they're going to be under cross-examination in court, that also kind of puts some urgency on it. So I think letting the court officers and the judges be aware of what those process and protocols look like, so that way they can also support us in what we're doing to try to get the family finding.
That's great. Thank you. But yeah, I mean, I think that's a great point. And I also want to circle back. Brianna, I love what you said in relation to, I think I oftentimes think about this work in relation to saving families' time or being respectful of families' time. But you took us a step further of, that's like trust building exercise to really go back and build on, that's affirming and centering family voice, not just initially, but throughout the interaction and support of that child and family. So thank you both for that. Ali, I saw you come off. Are you?
I have a question.
Oh, yes. Sorry, Antoinette.
I think that when I was a worker, a lot of times it was hard to get the information from the families because they were so guarded with me. And using like for our family search and engagement, like coming in as a different party on it and calling the family members, I just feel like they're always so thankful. They're always like, thank you so much for reaching out to us. Like they want what's best for that kiddo and that family. And I just see a different side of them than being the worker, like calling and, you're calling with the bad news and you're calling, asking all these questions. I just get so much better feedback from families, and just they're so receptive and they're so grateful that we are trying to keep these kids with somebody that they know.
Reinforcing that message.
Yeah.
Antoinette had a question for us. And Antoinette, you're the final question.
I wanted to say thank you so much for this because we are practicing family finding, but making sure that we are maintaining that practice, especially when one person leaves and another one comes on, making sure that supervisors are always, looking for families, even if that child is placed with a kin already. My question is, so I love the fact that the CPS team already have a family finding unit, and they're doing their due diligence to find families before placing children outside of kins. So I would like some information or some guidance around how do you maintain that? Or have agencies been able to maintain that once the child is placed in foster care? And where is that information? So in Rhode Island, am I saying that right?
Yep.
The tab that you can search.
Yep.
And so when that child is placed in care for a while, going through the progress notes to try to find out when there's no tab is a challenge. So has there been any other agencies that have been able to tap into the work that the CPS has done in finding all of those kins that kids in foster care and the staff that's working with children that are already in foster care can tap into?
So as far as Rhode Island, the CPI also have access to the TLO tool that we use. There's like 2 people down there that have access to it. So if they're on if they're on the shift with those people, they'll have them do them. But Carol and I also do TLOs after hours. So if I'm up, I'll do it. I mean, I have 2 kids, I'm home a lot. So I really do them a lot. So, but when the case moves, that TLO, the actual like hard copy of it, it translates with the case. It's in the case file, but then we also send the new worker a copy of it as well.
And for us, we have 2 meetings within the first 10 days of shelter. We have an initial MDT meeting, and then at the 10-day mark, we have a family team meeting, and our investigators attend both of those, as does one of our family finders. And so if that information actually does end up coming over blank, or there's things that we think are missing, then we are making sure that that is fully completed at one of those 2 meetings.
Thank you both. And I think, hearing these themes for you, Antoinette, of whatever the system is, the idea of whatever's done early, having a single place, whether that's just in case notes or whether that's a separate document or whether that's a separate system, it might look different, but starting that soon and keeping that documentation so that folks, to your point, way later can come back and refer to it and, read and build on it, is a really powerful principle here. Thank you all so much. I know we are 1 minute almost to time. I'm going to pass things over to Melissa. It has been great hearing from all of you. Thank you so much for our presenters for sharing and for our folks asking questions in the chat.
Yeah, thank you all so much. And thanks for those of you who came to share your experiences, and for all of you who joined us today. It was a great conversation, and thanks for sharing your questions and experiences as well. Next session will be on December 5th, and the topic is how to leverage the court system to encourage kin finding. And also we're going to be hearing more from Rhode Island on their experiences with extreme family finding. So hope to see you all then. And thank you very much. Have a great afternoon.